I had a teacher in my medical school at Albert Einstein who had a thyroid clinic, and he was very generous in his time. And the goal of my Instagram is to help empower you so that you can diagnose or help the patients or realize if any one of your loved ones may need attention. So this beautiful lady was kind enough to allow us to show how to palpate the thyroid. Now, if you look carefully, there is a little bit of fullness around here. Now, it's hard to see it in other people. In some people, it's easy. The way you do it is you put your fingers across gently. Don't want to make them feel like you're suffocating them. Your fourth finger will be laying right at the bottom of it. Your pinky will be touching the collarbone. It's called the clavicle medically, right in the medial part, meaning the central part. And as you palpate it, you will feel that there is a loss of this indentation that we have here around the muscles. So this is the muscles of the neck, the sternocleidomastoid muscles, and there is an indentation over here. Here you can see that there is fullness there, and the way you can tell that that's what it is you can ask them to swallow, and then you know it's not the muscle. And as she swallows, it moves up a little bit. If it was the muscle, it will stay stable in here because the only part that moves is the trachea, the anterior, and the esophagus, the food supply behind. So as it moves a little bit up and down, swallow again. Sorry, thank you. You'll be able to see it. So again, глотните без момента, чтобы я держал. Just swallow again. Okay, so it's hard because she's already dry and she's dry, but it moves up and down. So this is the thyroid, and you understand that it's enlarged. And she had ultrasound, so it's not like we diagnosed it first. She has ultrasound, and it was proven to be enlarged thyroid. In women, it's normal to have thyroid nodules, but if it gets to a certain size that's too big, you should better remove it because there is a higher risk of malignancy developing in that. And sometimes even a needle aspiration biopsy may not reveal it. So it's really important that you follow it. If you lived in Ukraine and you came after 1986 and you were exposed, therefore, even though you think you were not exposed because you're far away from Chernobyl, you may have been exposed to the radiation, your risk is much higher because thyroid is one of those organs which is very sensitive to radiation. So it's really important that you see the endocrinologist, see ENT specialist, and follow on that on a regular basis with an exam, and if necessary, some tests, and more if necessary. Hopefully it was helpful. Thank you very much.